All right, hey everyone this week. I'm Nurse Jessica. This is my channel, Real Nurse Talk. We have a super exciting interview this week with the Rebecca. She's so great because she is a nurse that I worked with for 2 years on Med-Surg, and when I thought about who I was going to interview for my Med-Surg interview, I was like, it's got to be Rebecca. She's super positive, she's super smart, she's a great teacher, and so here she is to drop some knowledge on you guys. Okay, so now I want to ask you to introduce yourself, just talk about sort of your background as a nurse, what made you want to be a nurse. Okay, go.
So, my name's Rebecca. I am a Med-Surg nurse. I've been a nurse for almost 5 years now. Before I was a nurse, I was actually a teacher for about 12 years, on and off, in between babies, children. Went to school in my hometown, second degree, kind of a second career. And yeah, so I love my job. I didn't at first. It was really scary and it was hard.
Yeah.
But it's good now.
Yeah, nursing's definitely scary in the beginning because there's so much you don't know. I mean, even just finding supplies is kind of crazy, right?
Daunting.
Yeah. But now you're like an OG over there. Everyone goes to you with their questions, I think.
Been there a long time.
Yeah. Well, let's talk about Med-Surg a little bit. What are some qualities that you think a Med-Surg nurse needs to have for people who might be questioning what kind of nursing they want to go into?
I think Med-Surg is a lot of time management, knowing what things are important and when to get certain things done with the flow of your day. Mm-hmm. I think a lot of learning goes into that, and you started getting your rhythm, your flow. Yeah. I think people skills are important. You deal with people all day, doctors, other nurses, your techs, your aides. Just having a roll with it kind of personality.
Yeah, you kind of got to go with the flow, because talk about your patient load and then the CNA's patient load.
So as an RN or a LPN, you're going to have 5-6 patients, and then CNAs will have up to 14, right, on the hall?
Yeah, so think about that. There's 14 people and basically 3 people taking care of those 14 people. So that stretches you kind of thin. You might feel like 12 hours is a really long time, but
it can be.
That's sometimes it might feel like it is really long. But when you divvy up everything you have to do throughout a day, like talk about everything you need to do for a patient through a day. Like typically, I know there's...
So a typical day would be going through each patient's chart, learning their medications, their allergies, their health history, how all those medications have ramifications through their history and what they're currently in the hospital for. There's social situations that you may or may not need to factor into all of that. There's procedures that you need to know. What does your patient need to have done this day before a procedure? There's medications to pass all throughout the day. There's vital signs every 4 hours to keep track of and know which medication do they need or not need in order to keep that vital sign stable. It's kind of exhausting just talking about it.
I know, it's a lot to juggle. And then talk about what some common procedures are that Med-Surg nurses do a lot, like maybe IVs, for example, etc.
IVs,
nursing skills.
Foleys, for sure. In and out catheterizations, get patients ready for different procedures, endoscopies, colonoscopies, major and minor surgeries, procedures like CAT scans, MRIs.
There's a lot.
There's a lot.
And then give a little rundown of all the various like ancillary support that you also talk to for each. Try to understand that the primary nurse is the glue for the patient. So there's the patient, there's the primary nurse, and then the primary nurse basically conveys all information between the patient and everyone else. So who is everyone else?
Everyone else would be all the doctors, the specialties, the cardiologist, the pulmonary doctor, people who work downstairs in the endoscopy. So also the radiologist, the people that take them down for ultrasound, CAT scans.
Yeah, transporters.
Physical therapy, occupational therapy, speech therapy, that's a big one.
Yes. Yeah, especially for people who are having issues with swallowing. Maybe they had a stroke, or maybe just even from general weakness.
Yes.
And then one that you didn't say, I was thinking, was case management too.
Oh, case management, yes, huge.
Yeah.
Yes. If you want your patient to ever leave,
Yes.
case management.
You got to talk to case management.
Yes.
So that's the nurse that is in charge of figuring out where the patient's going to go when they leave, and if it's safe for them to go and where it's safe for them to go. Because some people come from home, but it's just not realistic for them to go back right away. So yeah, so think about having 6 patients and having to talk to all those people throughout the day, as well as pass your meds, help your patient go to the bathroom, explain procedures to them, talk to the family members. It takes a lot of time management, which is why I really want to applaud med-surg nurses, because I think med-surg is underrated.
It's very underrated.
Don't you think?
Yes, it's hard.
Yeah.
And then you have to chart everything that you just did.
And then you have to chart everything. So what do you say to people who maybe think med-surg isn't a specialty?
I say they haven't worked med-surg.
And that is true. And I think as a nursing student, and maybe you had this experience too, like the nurses that I worked with in different specialties that were the most understanding usually started in med-surg.
Yes.
So they're like, they understood that. I mean, you're the front lines. You're totally front lines there.
And I think it is best to be med-surg for a while, because you gain so much knowledge, so much understanding, so much comfort with so many different things that you really can jump to a specialty from there and be very confident in your nursing knowledge.
Yeah, I think that's a great point, and one that I just want to accentuate for students. If you feel like med-surg isn't cool enough for you, just really think about it, because I started med-surg too, and I would not give up that experience for anything, because I feel like it prepared me for what I'm doing now in the ICU, and I feel like it really got my time management down. It really got, because not all patients and not all families are willing to accept your knowledge or your position. Some people can be really difficult.
Yes. Agreed.
Yeah. So
and that's a whole nother facet, is dealing with family.
Any tips for that?
I think communication is key, and always approaching people with kindness, and knowing that everyone in the hospital is probably at their worst moment.
Yeah.
They're scared, they're afraid, they're sick. They don't understand. Everything that you and I feel like is routine and daily, to them is completely foreign.
Yeah.
And no explanation can be too simple.
Yes.
And I don't think you can give too much kindness and understanding to anyone.
Yeah. And I think it's fair to say, just assume that your patient knows nothing. It's way better to over-explain something than to just say, okay, I'm going to give you a Foley, go get the stuff. You come in, start lifting up their gown. They're like, wait, what's going where? You might want to really explain that one. Or even just a medicine, like Pepsid that we give to everyone. But someone might not know what that is, or what that's for, or why they're getting it.
Right. And that can be scary.
Yeah.
And that puts people on the defensive and on edge. And
yeah, so you could be setting yourself up for failure just by not explaining.
yes.
And I think part of thinking, let's talk about this phrase, thinking like a nurse, because it's something that you might hear in school, or you might hear when you're new. You need to start thinking like a nurse. And to me, that's sort of seeing a problem before it even happens, and maybe learning to prioritize. But you work with students a lot. How do you help them think like a nurse?
I think helping them see potential safety problems. You always want to think what's safest for my patient. And I know in nursing school, that's all you learn is how to be safe. And pretty soon you're thinking, well, what about my patient? And what about, you want to put too much into that, but it all starts with being safe and helping them, even seeing a cord here, plug this in.
Yeah.
Some of them, they still take the cord across the room and
yeah, right.
Because you're thinking about so many other things.
Tripping. Yeah.
It's just those little, the ultimate safety as thinking what is the best. And I didn't think that way at the beginning.
Right. No, me neither.
But looking back on it now,
yeah,
I realize that you do have to think that way. Yeah.
I know. Can you remember, like, when you first started as a nurse, like walking into a patient room and what you saw or maybe didn't see, and then when you walk into a room now, all the things you automatically take in? Do you know what I mean?
So much, yeah. Yeah, I remember when I would first walk in, it was more just being overwhelmed with all of the things that I saw and not knowing what to do with all of them, with all of the IV bags, with maybe the Foley, with the patient who doesn't even quite look alive. You're looking at, are they breathing? There were so many beeps and so many noises, and you're looking at the board and just not knowing how to filter all of those things.
Yeah.
But after a while, you start walking in and you just recognize things. You look at this, you look at that, and you process it very quickly.
And you know what questions to ask,
yes.
too. Because I think when you first start, you might get report and you just accept that the other nurse is more experienced than you, and they'll say, do you have any questions? And you're like, probably, but I have no idea.
I don't even know what question to ask.
And then you're doing your assessment and you're like, oh, I don't know what their skin looks like, or I don't know how much oxygen they're on. And so you start to, when do you think that started to really click for you?
Oh, probably maybe after about a year.
A year?
6 months to a year.
Yeah, I would agree with that.
Where you start really, where you notice the oxygen and you don't even know that you noticed it.
Yes.
But it's just, oh yeah, I remember seeing that, and I remember seeing this, but when you actually are gazing across, I don't remember really doing it. Does that make sense?
Yeah, yeah. It's like you don't know that you know so much now.
Or maybe you don't know what's important at that time until something goes a little haywire, and then you think, okay, that's an important thing to notice.
Yeah, ultimately experience is the best teacher.
Agreed.
And that's hard because you get a lot of...
Sometimes a bad experience is the best teacher.
I know. And have you ever had an experience where you just had to go cry in the bedroom?
Oh, of course.
Totally normal, right?
Usually I got home, or usually it was in the shower before work.
Before you even got there.
Oh God, I have made the biggest mistake of my life. I think there's only been twice where I actually cried because of a situation. And I felt that my patient was, I felt that I really needed to intervene, and I had intervened, and yet things were still going kind of haywire for them.
Yeah.
Yeah, and one was just a very overwhelming situation, a family situation that had kids involved, and that was difficult.
And I think what's important about that, like we were talking about before we started, was you said the most important thing is knowing who your resources are, right? So do you want to talk a little bit more about that for difficult situations?
Yes, so for resources, you always have your case manager, you have a social worker, who I think they can be invaluable.
Oh, totally.
And they have more access to outside community resources that we may not even know are available. People who may be homeless, people who just lost their job, people who have small children and no family, and they don't know what am I going to do? Who's going to take my kids to school? The social worker I have found to be very helpful.
Yeah.
And I think just being a nurse, you don't have to know everything. You cannot know everything, but if you know where to go for help, that's the best thing to know. Know who your resources are, and it'll kind of make you look like the hero when you're not. But you might save the day in some way.
But in a way, though, because some nurses might just say, I don't know, and not look for the answer. And I was always told it's okay to say you don't know.
Yes.
It's not okay to not even try to find out if it's something that really is important to the patient.
Or to pretend that you know and make a wrong decision.
Definitely.
It's always better to say, I don't know, but I'll find out.
Yes, and I think people respect that when you just own that,
Yeah.
as opposed to kind of floundering through an answer that's not really an answer because you just don't know. It's okay not to know, because they can sense that, and then they lose confidence in you. You know, so know what you know, and know when you don't know something, and you need to go take it to someone else, and that's totally okay.
Absolutely okay.
Yeah, especially when you work in the hospital, you know a lot about what goes on in the hospital. The patients want to know, well, what happens when I get to this other facility, or what? But we don't know because we don't work there.
Right.
So I feel like we have great case managers, and they've always been really helpful for me.
Agreed.
And will actually go to the patient's room, or at least tell me over the phone if they really can't come in.
And a lot of them have worked where we are. And a lot of them have worked in the other side of the field, in the nursing homes and skilled nursing and LTAC kind of situations.
Yeah. And then let's talk a little bit more about the relationship of the nurse and the CNA for people who may not know about delegation or all the awesome things that CNAs help us with.
Nurses would die without CNAs.
That is true. We would drown.
Yes, they are amazing, and they are underrated and underpaid, in my opinion.
I'd agree.
They have a huge responsibility.
Yes.
With just taking vital signs. An extra set of eyes on your patient is so valuable. And when they see something that concerns them, that they go right to you, and then, none of us can be aware of everything all the time. And as far as delegation, I think that was the scary part of nursing school, was thinking, oh, I'm in charge of someone, and I didn't sign up for this, and you don't quite realize how that, and I don't know it's so much delegation as it is a relationship.
Yeah, I'd agree. I don't know if you were ever a CNA before you became a nurse, but I did do CNA, and I had a really good experience. I was really glad that I did it, because I appreciate them so much now, because it really is a heavy load. And then I also really appreciate the CNAs who take their jobs seriously, and if they've been in a room more recently than me and they notice something's different, they'll come and make me aware. Because, especially when you have single patient rooms and you've got 6 of them, obviously you can't have eyes on everyone all the time.
All the time, that's right.
Not even close. Pretty sure they don't have cameras in every room, at least not that I'm aware of.
Nope.
Pretty sure
Not
that's
that
still illegal.
Still illegal. That's right.
So let's talk about positives and negatives. Do you have, you're still doing med-surg, and one of the reasons I picked you is because I feel like you're one of the really positive nurses. So what is something that really keeps you there that you really enjoy?
I really enjoy sending people home and
Yeah.
seeing them better. And I feel like with med-surg, you get to see that continuum. You may see someone come in super sick, where it looks very dire for them.
Yeah.
But you do get the satisfaction of seeing them get better.
Yes.
And it's like in the ER, you're not going to see that. You see someone super sick, and then you send them somewhere. Where did they go? You hope they're okay. But to me, that gives closure. To be able to send your patient home, or even to the nursing facility where they're 100% better and they're going to be okay.
Yeah.
And I enjoy that. I enjoy the relationship that you can form with a patient over time, and seeing them leave. And I think that's good.
And aren't patients, like, sometimes they're just so sweet, and it just makes you feel so appreciated, especially if you're having a bad day or something, and they get to go home and they tell you thank you so much.
And they give you a hug.
Yeah.
Or their family member says, thank you so much. We couldn't have done it without you.
Yeah. Or sometimes they even bring us pizza.
Coffee, donuts, chocolate.
We love all those things.
Yeah.
Just
we always
we love
want
to stress
chocolate.
eat.
Yes.
But so it's, these relationships are mutually beneficial, and I think that's something that's maybe easy to forget sometimes, or But you really do get a lot too from getting to.
Yes. And just getting to know people, because you get to talk to them.
Mm-hmm.
And I've heard so many amazing stories. I've heard love stories. I've heard stories of, you know, women who have lost a child, women who have then adopted the child, World War II brides who came. I feel like I have learned thousands of life stories that will be with me forever.
Yes.
And I enjoyed that.
Yes. And that is something that if you enjoy communicating, interacting with your patients, really getting a history on someone, learning something new, MedSurg is a great place for that because most of your patients are with it enough to be able to have a conversation. Of course, some people are too confused or some people are just too sick to even stir, but you get some really cool stories.
Yes, you do.
That is true. Okay, so let's talk about a negative. What is your least favorite thing about MedSurg? It could be something small. It could be doing IVs or bedpans, or it could be something big.
My least favorite, NG tubes.
Why is
Can't
that?
stand them because vomit really bothers me.
I think we all have like one bodily fluid that just
bleed on me, poop on me, pee on me. Do not vomit on me.
That's your line.
That is my line.
Hey,
I will turn your head.
Yeah. Well, I'll take your NG tube if you take my ostomy bag. Because
I got
that's
it.
the one that
I got it.
That's the one that's hard for me.
NG tubes. I've even had dreams where the doctor wanted me to put one in every patient that I had, and I literally left.
Yeah.
I was running out of the hospital.
These are, I know. And have you ever had the dream where you just can't, like you have this to-do list and you just can't get it done and you're in your dream like floundering? And these are nurse dreams. These are real. Sometimes they're real life.
Sometimes they're real life. Yes.
Okay, and then, so lastly, do you have anything you want to share, maybe an important memory with a patient? Nothing too specific, but something.
Actually, today I was at the hairdresser, and I was thinking about, it reminded me of a patient that I had a while back, little older lady, and she had brought her curlers, you know, the old-fashioned ones with the pin. And her husband was trying to put her curlers in for her. And he had the little spray bottle trying to put her curlers. And I walked in and I thought, I could do that so much faster. But I don't really have time.
Yeah.
But I just couldn't let it go. So I went and I said, do you want me to help you with this? He says, you don't have time. No, I didn't, but I did. So I put all of her curlers in. She had her little scarf on. And she woke up the next morning, she was taking them out. She slept in them. And we combed her hair and she went home looking beautiful.
I love that.
And it was
story.
so sweet. Yeah. I'll never forget her.
You know, sometimes it really, something might not seem like a priority, but then in a way it really is, because it just touches that person in a positive way.
And it was important to her.
Yes.
She looked good when she went home because all of her kids were going to be there.
Yeah. I think that's, you know, some people just need to have their teeth brushed or to,
to be human.
Clip their fingernail. Yeah. Just to feel human.
Yes.
So try to take the time for those moments when you have them. And we both know that MedSurg is super busy and crazy, and you don't always have that time, but when you do, you'll probably end up getting just as much out of it
You won't
as
regret.
your patient does.
I don't regret those times.
Yeah. Well, is there anything else you'd like to add?
I don't think so. Thank you so much.
That was really good. I think we covered a lot, and I hope that this inspires some people to start on MedSurg, because it really is a great experience and it will make you strong. I mean, just selfishly, it will make you stronger.
You will be a super awesome nurse anywhere you go if you can handle MedSurg.
Yes. All right, guys, that is it. Remember to like and subscribe to my channel and ring the bell. I try to drop videos every Saturday, and I'm trying every Wednesday the best that I can. So have a healthy week, and that's it.